All right, a couple housekeeping things. You guys are all muted. All audience members are muted, and you guys cannot change that. Your video should be shut off. And then just to optimize your viewing experience, I recommend you clicking your video tile if you have not already done so. Click your tile and then select hide non-video participants. And then if you do that, you should be able to see just the panelists, myself, and we have a guest for our second session. Apparently, we have someone who will be interpreting the webinar or translating the webinar with American Sign Language. So that's fantastic. Did not expect that. I did not plan that, but that's awesome. So my name is Jack Malafronte. There's two of us. Apparently there's two people translating. Do we need both people or is one person sufficient? I think one person is sufficient. Is there more? I think there's one person is sufficient. Okay, so we're just gonna go with Renee here, who is doing the sign. Uh-oh. Where? Okay, I'm back, sorry. We're just gonna go with Renee here. So my name is Jack Malafronte. I am a physical therapist and athletic trainer, sports PT resident at Texas Health Sports Medicine in Fort Worth, Texas. I did my undergrad in athletic training at Boston University. I did my grad school in physical therapy at Boston University as well. I am from just outside of Boston, so I am an unapologetic New England sports fan. But without further ado, I would like to introduce you guys to the panel. So I'll go around and introduce everyone, and then we'll let each panelist kind of talk a little bit about themselves and their residency program. So we have Trevor Kovacs, who is a resident at Texas Health Sports Medicine. He's one of my co-residents here in Fort Worth, Texas. We have Sheft, who is a resident at Vanderbilt University and Belmont University in Nashville, Tennessee. Erika Lark, who is a resident at the University of Southern California. Nicholas Mahaffey, who is a resident at the University of Texas Southwestern in Dallas, so just across the Metroplex from Trevor and I. Kyle Clark is a resident at Atlanta Children's in Atlanta, Georgia. Lindsay Gately is a resident at Memorial Hermann down in Houston, Texas. And then Jake Fine is a resident at Mass General Hospital and Northeastern University in Boston, Massachusetts. So let's get started. Trevor, why don't you introduce us to yourself and your residency or our residency program here in Fort Worth, Texas.
Hey guys, thanks for joining. My name is Trevor Kovacs. I'm from Los Angeles, California, and I am one of the current Texas Health Sports Medicine residents along with Jack. There's 5 of us, and then there's also a athletic training residency that we have, and we have Alex as well. So there's 6 of us in total residents. I did my undergraduate degree at Loyola Marymount University, studied health and human science, and then took about a year off, worked as an aide at an outpatient clinic and traveled, and then went on to USC to complete my DPT education. And then probably around second year, I had realized that a residency was something I wanted to do. I wasn't quite sure ortho or sports, but I decided to go the sports route, and I'm extremely happy I went that way and ended up here at Texas Health Sports Medicine here in Fort Worth, Texas. Sort of my 2 diagnoses that I really enjoy treating are ACL, reconstruction and repair, and concussion. And then soccer players would be my favorite population to treat. And it's been a real pleasure organizing this with Jack, and happy that we have about close to 200 of you guys on here. So thank you.
Great, Trevor. Thank you for the intro. Let's send it across the Metroplex to Nick Mahaffey in Dallas. Nick, tell us about yourself and your residency.
Sure. Yeah. Thanks, Jack and Trevor, for setting this up, and thanks everyone for joining. My name's Nick. I'm originally from North Carolina, did my undergrad at Appalachian State, studied exercise science, took a year and a half off of school, worked in a clinic as a tech, and then went back to PT school at Duke University and graduated last May. I'm now completing my sports physical therapy residency at UT Southwestern Medical Center here in Dallas. And our primary team and event coverage is with the Dallas Stars of the National Hockey League. And then I also do training room coverage and event coverage with Dallas Jesuit High School.
Great, Nick. Thanks. Jake Fine in Boston. Tell us about yourself.
Hey, how's it going, guys? Like Jack said, I'm the current sports PT resident at the Mass General and Northeastern University Sports Residency. I'm originally from Pittsburgh. I ended up going to the University of Maryland for my degree in kinesiology. Towards the end, I wasn't quite sure what I wanted to do when I graduated, but I was always leaning towards physical therapy. And like some of the other guys mentioned, I ended up taking a year and a half off and took a position as a rehab aide at one of the sports medicine facilities around Pittsburgh. Then about a year and a half later, I started PT school at the University of Pittsburgh. So throughout school, I always knew I was meant for the outpatient setting. And I was always drawn towards sports physical therapy. Like many of you guys, have been a lifelong athlete and always been a sports fan. And then finally, my last clinical rotation had a component of working within a Division III training room. So I had some exposure to the collegiate setting and the training room environment, and I decided I wanted to pursue a sports PT residency. So finally, when I graduated in April of 2019 from Pitt, I accepted a position at MGH in Northeastern, and I started in July of 2019. MGH and Northeastern is really cool because they are two separate institutions that are really only blended through the residency. And you really get the best of both worlds of being in a large hospital system through MGH, but also getting Division I athletic experience and experience in an academic institution through Northeastern University.
That is great, Jake. Let's kick it down to the southern part of the East Coast to Kyle in Atlanta, Georgia.
Yeah, thanks for having me on, Jack. It's nice to see everyone. I am the current resident at Children's Hospital of Atlanta. I'm from Illinois, went to undergrad at the University of Wisconsin at La Crosse. And I went down and also attended Duke University and roomed with Nick, even though he was too shy to make that public. I did my residency straight from PT school, so I graduated last May, and then I started my residency in August. It's 13 months, so August to this current September. My residency is a little unique, which we'll kind of get into the details of it, but I treat ages 7 to 21, so no one younger, no one older. It's a common myth that my residency is a PEDS residency, which is not necessarily true. I don't see neurodiagnoses or anything that you learn in a classic PEDS class, so we can kind of get into more of that a little bit later
on. And we'll save the ladies for last because they are the most important. Erika, out in sunny California, tell us about your experience in your residency.
Yeah. So I am from Kansas originally, the Midwest. I went to undergrad at University of Missouri. I majored in health sciences and got a minor in psychology, and I also ran track there. So that's what kind of got me on the sports route. I knew I wasn't going to compete in track at the professional level, and I wanted to stay involved in athletics in some sort of way. So I knew I was passionate about PT as well. So I applied to PT my senior year and got into USC's program. So I went straight from undergrad to PT school there. And then in my third year, I kind of confirmed that I wanted to work with sports again because I had 2 great clinical rotations in sports settings. So I applied to USC's sports residency program and got accepted. So that's where I'm at now. There are 3 residents total, and we're all at different locations, which I'll talk a little bit about later. I am at Select Physical Therapy right now in LA, and my sports coverage is with West LA College, Community College, and then Crenshaw High School.
Thanks, Erika. May Sheft is in Nashville at Vanderbilt University. If you haven't been to Nashville, I recommend visiting. May, take us away.
I definitely agree. As soon as COVID is over, come visit Nashville. You won't be able to do much right now. But so I actually went to Vanderbilt for undergraduate school. I'm originally from New Jersey, but as soon as I went to Vanderbilt, kind of just fell in love with Nashville like everyone else. Because I wanted to stay in Nashville, I decided Belmont PT school was hopefully where I'd go, got in. And then pretty much during my first year, I realized I wanted to do sports residency. I was pretty involved with Vanderbilt athletics during my undergrad and knew I kind of wanted to pursue their sport residency program as well. For those of you, if you don't know, you work with all the sports teams at Vanderbilt, you do research, and you help teach at Belmont. So that's why you work at both Vanderbilt and Belmont. We'll head it off to the next.
Last but not least, Lindsay Gately, another fellow Texan down in Houston, Texas.
Yeah, so like Jack said, I'm at the Hermann IRONMAN Sports Physical Therapy Residency. I'm originally from Long Island, New York. I went on to get my degree in athletic training at the University of Pittsburgh, where I became a certified athletic trainer. Went straight through to grad school at the University of Southern California, got my graduate degree in physical therapy, and then went straight to end up in Houston at Memorial Hermann's program. So I'm one of 5 residents within the Memorial Hermann residency. Each of us cover a Division I collegiate athletic training room and deal with those athletes. And each of us has a local high school. So my affiliation is with George Ranch High School. And we spend time both in the clinic and split between those 2 settings.
Thank you, Lindsay. So now you've met all the panelists. I don't think I said this at the beginning, but the way the rest of the night is going to go is we'll do some moderated question and answer with the panelists so that they can highlight different aspects of their program and we can kind of talk about the residency experience in general. And then we'll finish tonight with about 25 minutes of question and answer from the audience. We ask you to please use the chat function to submit your questions. And I ask that you please wait until we start the audience Q&A before submitting questions in the chat. So if we can take some time to talk about everyone's experience individually first. Trevor, why don't you talk about our relationship with TCU at Texas Health Sports Medicine and kind of what our sport experience looks like at Texas Health Sports Medicine.
Yeah, so pretty much all of us residents do our sports coverage with TCU. We do have a resident, Matt, who does his coverage with FC Dallas. So at TCU, it kind of looks like this. We have one PT, Bobby, who is one of our mentors as well. She is in-house and takes care of all their long-term rehabs from all the Division I sports there. And so on any given day, there's usually about 2 or 3 of us that are there as well. And so we're seeing, for me, I was in there about 18 hours a week, seeing the long-term rehabs across all the sports. And then the rest of my time at TCU was sports that I had an interest in. So I worked with beach volleyball, volleyball, soccer, primarily so far this year. And that's really one thing that drew me to Texas Health Sports Medicine is they really let you choose what sports you want to work with and where your interests lie. You can kind of go down that path. So if you're really interested in baseball, they'll make it happen where you are spending your time with baseball and vice versa. So I think that's something that really drew me to Texas Health, along with the fact that we do exclusively pretty much all our coverage with the Division I powerhouse, a Power 5 team. So that's really something that drew me there.
That's great, Trevor. Yeah, I mean, it's a great opportunity at TCU that we have that relationship. I was fortunate enough, I am dual credentialed, and there were some staffing issues at TCU during the season. So I ended up being the women's basketball athletic trainer. I split it with one of the graduate assistants, but I was traveling with women's basketball for TCU. So Division I, Big 12 basketball. I was basically coordinating their care with another individual. which was a really cool experience and an opportunity that the residency provided me. Jake, you have quite a bit of experience working with Northeastern up in Boston. So can you talk about your Division I sports experience you get at Northeastern and what sports you work with and kind of stuff like that?
Yeah, absolutely. So I think one of the benefits at working at a university like Northeastern is that, kind of like TCU, you know, we're on the smaller end of Division I programs. And I think that affords us more opportunities to kind of be more directly involved with the care of these athletes. Through the Northeastern program, I've had a variety of experiences. You know, my main coverage was initially with women's soccer. And then through the winter, I was assigned to women's basketball and also men's hockey. And then kind of right as the COVID-19 crisis was coming about and things were shutting down, I was getting more involved with men's baseball, which was great. But I know a couple other people are going to talk about this later, but there's kind of a nuance within the training room, and a lot of it is about developing relationships within the training room, and really being able to build an alliance with that athletic trainer who's heading up each of those individual teams in a college setting. I think that Northeastern does a really good job at getting the sports residents involved and making us feel like we are a huge part of that athlete's care. And I think it's going to continue to grow. Like everyone's talked about, a lot of these residencies are really young, and I'm only one of I think I'm the 5th set of residents to go through this program. So overall, it's been a great experience and a great introduction into Division I athletics.
Thank you, Jake. Lindsay, I spoke about it a little bit, but I'd like you to dive into it a little bit more as the only other athletic trainer on the panel. Can you talk about some of the advantages or different opportunities that you've had within your residency being dual credentialed?
Yeah, absolutely. So I think it's a great question. As far as tangible opportunities given to each resident, I think we do a great job of providing pretty equal coverage opportunities and exposure to on-field coverage for all residents, whether or not you're dual credentialed or not. I will say that having the dual credential is not a disadvantage by any means, and it kind of falls in line with more of non-tangible things. So, for example, where I'm at is Houston Baptist University, which falls in line with what Jake was saying, a smaller Division I school. So we're kind of relied on a little bit more than maybe somewhere like University of Houston, which is one of our other sites. So I walk in one of my first weeks and there's 10 athletes waiting with maybe one other athletic trainer in the room. So to someone that hasn't really been exposed to that environment, it can seem very overwhelming and not something you're super comfortable with, but that's why you're here for the residency. So I think having that dual credential and getting that exposure beforehand was something that was huge for me. Not to say that the people that are not dual credentialed learned and grew very quickly in that setting and were able to kind of meet me where we're all at and get to that same level. But I think having the dual credential just lends itself to understanding the culture of athletic training as well, and knowing that you need to be there and you need to be accessible to these people and realize that you're not better than the athletic trainer because they have experience that you don't have. So having that is definitely helpful. However, I think if you're personable, if you have a good work ethic and you're willing to maybe go to the training room and stop by on a day you're not supposed to, or, you know, be texting and giving information and sharing information with athletic trainers on off hours, and you show that you're willing to be there, then it doesn't matter if you're dual credentialed or not, you can be on that level.
That was great, Lindsay. Yeah, I think it is important to highlight that it's you don't need to be dual credentialed to do a sports residency, as evidenced by the panel, with most of them not being dual credentialed, but it is definitely not a disadvantage. And I'm sure there are some dual credentialed or soon to be dual credentialed individuals in the audience. And I think it's another feather in your cap, and it really can maybe open some different doors during your residency experience. Nick, I want to ask you a question, kind of changing gears a little bit. So I want to ask you a question. What is your experience like working with the Dallas Stars? And then kind of a follow-up to that is I want to know if our attendees, should they be very hockey focused if they're applying to your residency program with the experience with the Dallas Stars? Or do you think someone who's maybe not necessarily hockey focused could still thrive in the program?
I would probably tend to say that your first statement is more accurate. I think that's the beauty of all of our residencies is that we found something that we were interested in the residency. It doesn't have to match 100% of what we're involved in, but for the majority of it, where you're going to spend your time and where you're going to get your experience, it better be something you're interested. So that being said, I definitely would say that having an interest in treating the hockey athlete is something that you need to have in my residency, just because of the volume that you're there and that I work with the Stars. And that also being said, the lack of maybe the overhead athlete that I see, same thing goes. If you're interested in that kind of treating that athlete, then maybe this isn't the residency, for you. So yeah, that's a good question. But the experience for me has been great. I had the fortunate opportunity to work with the Hurricanes when I was at Duke for a couple of years while I was in school, and so that experience kind of led me into this residency specifically, and it was something I loved and I wanted to continue working in. So that's been great. It's awesome to have the interprofessional experience that you get at the professional level. That I think is super unique of just working alongside physicians, strength coaches, athletic trainers, massage therapists, chiropractors, dietitians, nutritionists. I mean, they have it all, right? And so these athletes are at the top of their game and they're getting, top level care. And I'm lucky to be there just to kind of soak it all up and learn as much as I can from these people. So it's also unique in that one of the previous residents to go through the program is the full-time physical therapist for the Stars. And so he's always there when I'm there, and he is also a mentor on faculty for the residency. So it's a unique environment that not only I get to get hands-on experience with professional hockey players and but also get the mentorship out of being a better clinician and being a better PT. And then there's challenges with it as well, as in terms of the locker room, environment being tough to get comfortable in, and everyone feel comfortable with you being there. And I think that is unique to every sport at every level, but definitely at the professional level, it definitely is the hardest that I've seen. So.
That's great, Nick. I mean, obviously in a professional sports setting, you're going to have a pretty large medical team and an extended medical team when you think about strength and conditioning. So I'm sure the opportunities to collaborate are endless. May, I would love for you to talk about, a different kind of collaboration that a lot of us get in our residency, but can you talk about your teaching experience at Belmont University and how you're able to collaborate with faculty and get that side of the residency experience?
Yeah, I'd love to. So if anyone doesn't know, for the Vanderbilt residency, we also work heavily with Belmont. I am maybe a TA. They don't really give us a title for the orthopedics lab. And on any given day, I could be told, hey, this is the portion of the lab you're going to teach. Go for it. And they don't really give you heads up. You obviously know the body part and the outline of the lab for the day, but you might be teaching special tests, or you might be teaching modes, treatment plans, something along those lines. So definitely always keeps me on my toes, and you have to be prepared. And that's about 2 half days a week, just being in lab. So maybe a total of 6 hours physically in lab, and then maybe 10 hours total putting in the extra effort for making lab schedules, answering student questions, things like that. And for those who aren't as big of a nerd as maybe some of us on the panel are, the head professor of the orthopedics lab is Michael Voigt. He's a huge research guy, especially with the hip. So learning from him has just been incredible. So I thoroughly enjoy the Belmont teaching aspect. I feel like it really challenges me to make sure I know my stuff and that I'm prepared, and it helps me speak in front of people. And I want to eventually become an adjunct or associate professor at an institution, and I think it really prepares you for that.
That's awesome, Meg. Thank you. So shifting gears a little bit, Erika, I want you to talk a little bit about kind of USC as a whole, and you guys have a very strong alumni base. Talk about that, and then let us know if that played into your decision making at all. I know you did PT school at USC, and that's where you're at for residency. But just talk about USC's alumni base and kind of the network that you have there.
Yeah, for sure. So obviously being a part of USC alumni and being involved in the program still provides me with a lot of opportunities. For example, we have some USC faculty that are associated with the Angels minor league and the MLB league as well. So we had the opportunity earlier this spring to go do pre-participation screens with them. So that was a great opportunity to get that hands-on experience with higher level athletes for sure. And then also we do get involved a little bit with the USC athletic training staff. So we had a sports module where we got to go to the USC athletic training facility and learn from some of the athletic trainers and the students there. So we learned like taping techniques, spine boarding, all of that while we were there. So that was really good to kind of get a setup for the sports coverage that we were going to be doing later on that year. We also have a pretty cool opportunity. We get to work a lot with the orthopedic residency, which is really good. We do lit reviews with them weekly, so we are able to really work on our manual skills, our clinical decision making, all of that. So that's really helpful. And then we also have access to their faculty. So we're really still involved with USC as a whole. A couple other opportunities. They do talk to us a little bit about the fellowships that they have. So we do have a D1 fellowship where you work with UCLA if you want to keep pursuing the D1 route. And there's also an upper extremity elite athlete fellowship where you get to work with the Angels for about 4 months out of the year, and then you work at a clinic on USC's Health Science campus. And lastly, if you are interested in teaching, there's an opportunity for that as well. We teach the Pediatric Sports Day for the DPT2 students in the USC program. And then also one of our residents is really diving in, and she's doing a therapeutic exercise for the DPT program. So you can get involved with teaching if that's something that you want to do. It's just something you kind of have to talk to them about it and go for it. So even though we don't do that much teaching as a sports resident, you can get more involved if you want to. So those are just some opportunities being involved with USC that's really helpful.
Thanks, Erika. That was great. And then last but not least, Kyle, don't think I forgot about you down there in Atlanta. Don't fall asleep on me. I know it's late on the East Coast. Kyle, talk to me a little bit. I know this is the same question I asked you in session 1, but I think it's a big question that we need to hit on. So talk to me about kind of the misconception potentially that you are in a pediatric residency, you're associated with a children's hospital. What patient population do you see? What does your sport experience look like? And why are you not in a pediatric residency?
Yeah, absolutely. It's a big question that needs answered. Like I said, it's not neuropeds like everyone kind of thinks, and the stigma that I have with that. It's a sports residency, just like everyone else here. It has its differences. It's not professional. It's not college. My sports coverage works with high schools in the area, so the children's system has different schools that they're partnered with, and I can pretty much go to whatever high school I want. So it varies between large private schools in Atlanta to some of the inner city schools in Atlanta. So it's a good variety there. And then there's also middle school club sports that I get to do. So I've learned more about gymnastics than I ever really thought or wished that I would have, it's great. I really enjoy it. And then my caseload is, like I said, 7 to 21. The majority is about 13 to 18 or so. And those vary. I mean, just like everyone, your patients are going to vary even if it is a sports residency. So I have Division I prospects that are going to play soccer, football, basketball, whatever it might be. But then my biggest thing is I have the 9-year-old that broke her arm or the ankle sprain. She's never been hurt before. So it's kind of dealing with the younger patient population, which is something that I sought and something that I enjoy. At the time, there were only 4 children's residencies when I applied, and that's Cincinnati Children's, Nationwide Children's in Columbus, Texas Children's in Houston, and then CHOA, Children's Healthcare of Atlanta, down here. Right now, I think there's 6. I could be wrong, but I believe there's one out in California and then one in Denver. So it's different. No Division I type training room aspect to it, no professional hockey team locker room aspect to it, but it's something that I enjoy and something that I've wanted to do. So I highly recommend looking into it. It's not neuro. There's no peds neurologic cases down here, so it's good.
Awesome, Kyle. That's great to know. So all you attendees, if you're interested in the pediatric athlete, send Kyle an email because he'll tell you more about it. It's not a neuropeds residency. All right, so that is going to be the end of our moderated Q&A. So now we're going to open up the chat, guys. Feel free to submit questions. I also have some questions that you guys submitted during your registration, so we'll try to get to as many as we can. We did hit on some things in the first session, and there will be a recording of that if you want to go back. We're going to try to cover as many topics as we can. While we wait for some questions to come in via the chat, I want to ask Lindsay and Erika and May, the 3 females on the panel, to talk about what it's like for a woman in a typically male-dominated setting. That was a question that we got submitted prior. I know Lindsay definitely was passionate about answering it, so I'll let you guys kind of all take that as we have more questions come in.
Yeah, very passionate. So, yeah, I think at a base level, if you look at where we're at now versus 5 years ago, it's amazing how many of all of our residencies have females in higher up positions, whether that's our respective residency directors, the PTs that mentor us, the athletic trainers that we work with, the dietitians we work with. So we're surrounded by females in sports medicine, especially I can speak mostly to Memorial Hermann. So on that level, it's great because it's not like we need to walk in and be like, I'm going to be the female that breaks the glass ceiling here. Like, no, like we can just live our lives the way that everyone does. I will say that, you know, the experiences I've had, there's times when it's different and you feel like there is a difference in either feel or the way one person treats you or the way someone talks to you. And I'll just say that, one, it comes with a little bit of experience, but on the other hand, if you're in a situation where you do feel uncomfortable or you don't know how to navigate it, there's so much support both from female mentors and male mentors that are so supportive of where we are and what we provide to the settings that we're in. So I can speak that I've had amazing experiences here and have very little issues with that. If anyone else wants to.
Yeah, I mean, I haven't had too many issues with it, luckily. I feel like everyone's very accepting. I think a big thing is just coming in with confidence and knowing what you're talking about is huge, especially when you're young. I'm 25, so half the time the high schoolers and college kids think I'm just attending school with them, even though I have my athletic training attire on. So it's important to kind of set boundaries and kind of show them what you can offer them. And I haven't really had that many issues other than them thinking I'm close to their age and I'm not.
Yeah, I mean, I would agree. I don't have as many higher ups that are females, like Lindsay had mentioned. Most of Vanderbilt's higher ups are males. It hasn't really been an issue, but it is important to note that, you know, you are in the locker room a lot at Vanderbilt, and there is locker room talk. You know, that's just something that is very inevitable. And if that's something that you are not quite comfortable with, I would make sure that, you know, just put it out there. If you're looking to get into professional sports potentially, and you're not comfortable around being a little bit of not bad talk, but just locker room talk, joking around, you know, hanging out with people, then I would definitely make sure that's something you're comfortable with, because it definitely it definitely happens, but by no means has, anyone ever said anything that offended me or made me feel that I was inferior. It's just a very fun, joking environment.
That was great, ladies. If you guys care to learn more about that, Lindsay will be hosting a TED Talk on women in sports medicine. No, I'm just kidding. That was really good, guys, though. Thank you. Because that was a question we did get from multiple people. I have a good one here. So from Gianna Marie, she wants to know what our career goals are, which I think is a good question, but I think we're all going to have pretty variable answers. But what I do want to address is her second question. Do you think you would be able to achieve your goals without doing a sports residency? So Jake, I'll send it to you first, and then anyone else can chime in. So just talk about maybe how the residency, in your opinion, is going to help you achieve your goals.
Yeah. So I think the answer to that question is twofold, and one we talked about during the last session is my goals for getting into the academic setting. And what the residency has allowed me is to get some more formal training in an academic or in a classroom setting. So at the MGH and Northeastern residency, we have the opportunity to TA for multiple musculoskeletal classes. And that's one of the things that I was looking for when I thought out these different residency programs, is that they needed to have a teaching component, because that was one of my career goals. As far as if I could have got here without the sports residency, I think that's where the second goal of mine comes into play, and that's to remain involved, whether that be at the high school level or collegiate level, with an athletics program in some way. And I think that getting the SCS kind of sets you apart in that degree, and that getting the SCS without a sports residency, although not impossible, it is much more difficult because you have to coordinate things like shadowing athletic trainers and getting the appropriate amount of training room hours and sideline hours, which is much more difficult outside of the organized setting of a sports residency.
Yeah, to piggyback off what Jake said, you definitely can get your sports specialization certification studying on your own and doing the hours on your own, but I really don't think that's why any of us decided to do a sports residency. It's really that experience that's invaluable. Although we work long hours, it's that time in the training room talking with those athletic trainers, talking to the strength and conditioning, dietitians, all that stuff. That really makes it why you do a sports residency. So it is long hours, it's hard work, but it's the experience that really pays off. And, it's really tough to get a position at a university or with a professional team right out of school. So this is kind of one way to help get you that experience at such a young age and right out of school.
Thanks, Trevor. That was great. Jake, that was great as well. Renee is back. We're doing a little handoff of our American Sign Language interpreters. I love it. So a question came in here from Kyle. So he wants to know, do you think it would be more difficult to apply to a sports residency coming from a smaller private DPT program versus a larger program with more connections? So I think, unfortunately, I would say most of us have come from DPT programs that have connections, whether we have a lot of, former classmates or former alumni that do residencies, or like, May's case, Belmont is directly associated with the Vanderbilt residency, things like that. But something I'm pretty passionate about is I think that just getting exposure to residency is a big thing. I think that if you're at a smaller DPT program, that doesn't mean you are any less qualified than some of these larger schools. I think one of the advantages that we all could say from our programs is that we knew about the residencies and had the connections. But, I've spoken with our residency director, and, this is part of the reason we're doing this panel. So we can get this information out to anyone. If you're a DPT program anywhere in the country, you can learn this information and say, you know what, I want to do a sports residency. And I don't think it should matter where you went to PT school. If your resume and your credentials and your experience is is up to par for what a residency needs, I think it doesn't matter. I don't know if anyone has a thought there.
Yeah, I'll just kind of. Oh, sorry, Erika. I'll just kind of jump in real quick and say that most of our previous residents haven't gone to some of the bigger universities. So it's more than possible and encouraged, I would say. So.
And I was just going to say, I feel like when I was applying to like USC and other programs, they were looking for a lot of diversity. Like when I was applying to USC, they recommended, hey, it's good if you don't just get these letters of rec from people in the sports world, you should try and get some from the inpatient setting that you were in. So having a variety of connections and working in different settings and having that experience, connections isn't the only thing. It's the education that you're getting, the experience, the different settings that makes you more diverse and flexible. It lets them know that you're going to be able to adapt to the residency that you're going into. So that's a huge thing for them as well. I don't think it's just the connections at all.
That was a great addition, Erika. Guys, great answers on that question. Let's see, what else do we have in here? Nick, why don't you talk a little bit, and people can add upon this, but talk a little bit about the application process and what kind of how you find that fit of what residency you want to. Well, obviously, most people will apply to multiple, but how you decide which to apply to, and if you get multiple acceptances, how do you decide where to go?
Sure. Yeah. So what I did was, first hop on the APTA website, and I believe there's a residency and fellowship specific page that will actually list all of them for you. And even if you go to the RFP or RFPTCAS site, they also give you the list of all of them that are on there as far as the generalized application process. And there it's just kind of doing your own, homework and research to find out what they offer, who the relationships are with. I think one thing that's easy to start off with is geographic location. I think that was a big one for me. Was looking at different parts of the country, but then also having an interest in mind of what you wanted to do. I personally didn't even find out about the UT Southwestern one until I was talking to someone at CSM and told them about the experience I was working with in hockey, and they mentioned it. And so, I think just reaching out and then and learning about more information from the program directors themselves or the residents themselves. And you can find most of it online, but you can't find everything. So don't be afraid to kind of reach out and ask those questions about if there is an opportunity to work with a certain population of athletes, or to teach, or to do research and those sort of things. And in terms of deciding, I think it's and interviewing and all that good stuff in terms of the application process. It's a matter of how comfortable you feel with the fit, and does it align with your career goals? Does it align with your interests? Does it seem like something you actually want to do? Because it's it's a grind. It's a tough, anywhere from 12 to 18 months. And so you need to be in it for the right reasons, and you got to feel like you have the support system around you to do that. So I'd say that's kind of the best advice I have in terms of the application process.
That's great, Nick. I agree. I think the biggest thing is finding out what you want. There's about 50 residencies, sports residencies in the country. So while, a large amount, it's not a daunting amount. So figuring out whether it's geographic location, teaching experiences, Division I sports, professional sports, find out what you want, cut that list down and start applying. Call the residency directors, speak to the current residents, get contact information. Because it's one thing to read about a residency on a website. It's another thing to talk to the people who are actually there, either the ones who are in the residency or the ones who are in charge of the residency. Let's see. Another question, guys. We got this in the last session, but I think it's important to talk about. Someone let's see. Anyone want to talk about sports versus orthopedic residency? Trevor and I talked about it last time. Anyone else want to pick that up?
I can talk about it a little bit because I kind of was deciding my first year whether I wanted to do OCS or SCS. And I think it went down to a lot of where I wanted to, when I thought about long-term goals. Did I specifically want to work with sports teams, whether that doesn't necessarily mean professional athletes, but could just mean collegiate level, high school level, that sort of thing. And I definitely think if you're looking more to working with teams or higher level athletes, the SCS route is one for you. So I think it really, if you're deciding between the two, I would really just sit down and think, where do I see myself in, 10, 15 years? Because then that kind of maps out the steps that you think you need to take to get there. Because I do know a lot of professional sports teams want a PT who also either is an ATC or an SCS. So I would definitely take that into consideration if, working with higher level athletes is one of your goals.
Yeah, I just want to add to May's point and say some of the athletic trainers, especially at the higher level, really view that experience no matter what. Even if someone who has never been to school is doing it, like anything you're involved with in the training room setting, whether it's even doing dirty work like filling water bottles or helping out, athletic trainers at the higher level and on sports teams view that as extremely valuable. And even though going through an orthopedic residency can make you just as good of a clinician in different ways, I think that's a huge component that someone in that setting is just going to see that you didn't get that experience in. I know one thing I was considering between the two was, if I'm an orthopedic resident, I can kind of pick out zebras more and maybe find some things that a sports resident wouldn't catch. But as far as addressing everyone and keeping a team moving, their experience I've had here would not have been achieved doing an orthopedic residency.
Great, guys. That's some great information and great points. And I think it's very individual to each person. I think May really hit the nail on the head. Figure out what you want to do and kind of work backwards from there. And you should be able to work backwards, and that could kind of tell you whether you think you need to do a orthopedic or sports residency. This is a question anyone can chime in, but we got this prior as well as right now in the chat. This is from Anne. Does anyone know of any residencies that work with adaptive sports or Paralympic athletes? I don't. If anyone does, feel free to chime in.
I was going to say, I wouldn't say that I see it a lot, but we spent some time at an adaptive sports expo through UT Arlington, and UT Arlington itself just has an incredible adapted athlete sports program. But I don't know if I would, classify it as my residency has given me a ton of experience in that field. But I was definitely, my eyes were open to that side of sports PT a lot more so because I did this residency though.
Yeah, I would say it's similar here in Boston, where I would have had the chance to provide coverage at the Special Olympics if that was going to take place this summer. Unfortunately, it got canceled. So it's not our main coverage, but there are opportunities to work with adaptive sports. And also coming from the University of Pittsburgh, they created a cool program in the last couple of years called the Mighty Penguin Strength and Conditioning, where it's all ran by physical therapy students who are pretty much running a strength and conditioning type of workout for a sled hockey team in Pittsburgh. And I know that the current residents at the UPMC residency have an opportunity to work pretty closely with that program.
That's great information, guys. Thank you. One thing I want to touch on that we have not discussed yet is research. So I think research is kind of variable depending on what program that you get into. I know at Texas Health Sports Medicine, we're pretty heavily into research, pretty heavily involved. We have a 3D biomechanics lab at two clinics. We have an upper extremity and a lower extremity biomechanics lab. And we do a lot of clinical research, specifically on ACL and lower extremity athletes, as well as overhead throwing athletes. It is, we have a portion of our week carved out for research. And it is, it's an expectation of our residency that we produce some sort of research. I know Trevor is working on a manuscript right now, as am I, that will hopefully be published in a journal. But there are research opportunities in our residency. But I know that it kind of varies depending on people's residency. So again, it kind of goes back to what do you want out of your experience? And if you think you're very interested in research, I would identify those programs that can support that. With that being said, Trevor and I both did little to no research in undergrad and grad school. We both were accepted into the residency, and we both, I think, have thrived and kind of developed a little bit of a passion for the research here. So if you have not done research, doesn't necessarily exclude you from getting into a sports residency or doing research in your sports residency. Let's see. The earlier session was a little more active with their questions. Let's see. Let's do a little quick round table. I want everyone to just quickly talk about their, let's see, how many hours approximately everyone's working per week. Trevor, why don't you start here at Texas Health Sports Medicine? I know it's so, disclaimer, it's very variable, but I think people are curious what the residency week looks like. So just on average, how much we're working.
Yeah, I'd say typically we're doing about 50 to 60 hours. Like Jack said, it's variable depending on what sports you're helping with cover. A couple times this year, two of the teams that I was helping with had games or tournaments the same weekend. So those tend to be more involved. Or, you know, if we're doing a big screen on 150 baseball players and we got to drive out to Plano and do stuff like that, you know, things like that come at you. But it's really nice because there's, you know, every day, there's not a single day that I'm at the same site. So, I mean, bouncing back between clinic, TCU, things like that. So it doesn't feel like such a long day, and it's really enjoyable work. So it makes the time go by a lot quicker.
Erika?
Yeah, so I work 32 hours in the clinic, and it's actually pretty nice because we see a pretty big athletic population coming in because we do have the curling of surgeons upstairs. So that's nice. I do 4 hours of physician shadowing upstairs a week. We do lit reviews once a week, which is a couple hours, and then sports coverage, probably 10 to 15 hours, depending on the time of year. So that's kind of the breakdown. And I think something that's a little bit different for me is I'm either in the clinic one day or I'm doing my sports coverage or a lit review or something more residency related. So that I'm not doing like half days. I think only Fridays are for me are a half day, and there might be a game that night as well. So that's the only time I'm splitting my day between two things.
Lindsay?
Yeah, to break it up, I'd say I'm in the clinic about 27 hours a week. Then I spend a definite slated 8 hours a week in the college training room doing more rehab stuff, about 4 hours per week in the high school training room doing rehab. And then depending whether it's the fall or the spring, could be anywhere from 5 to 15 to 20 hours a week in additional coverage based on what your passion is or what you're expected to do in certain ways. And then we have 4 to 10 hours a week for research, physician collab, and didactic work.
Nick?
I would say it probably averages around the 50 to 60 hour per week mark. But I think this got brought up in the last session too. And it's not every day is a long, you know, drowning day. At least in terms of my residency, it's split up a lot of what you're doing on a certain day. And it depends on how many hockey games are that week. So it balances itself out. It's just a matter of the variability and what the week could look like from a week-to-week basis.
May, how about you?
So the Vanderbilt Belmont one, it's pretty heavy. I probably spend upwards of 70 hours a week with residency. And that's just because you do about 30 hours in the clinic, another 30 hours in the training room, and then your outside research and teaching. Now, granted, when teaching is over, you do more training room. So there's a little bit of give and take there, but we do all of our sport coverage on the weekends. So none of the sport coverage is during the week. So that's why it's just a little bit more hours.
Kyle, and then we'll finish with Jake.
Yeah, I found out last session that mine is a little down compared to everyone else. So I feel kind of bad now, but mine's about 40 to 50. And it ranges depending on the time of year and the week and all that stuff. But it's around 40 to 50, and it's fun. So it's not too demanding or anything like that. So I enjoy it.
And then Jake.
Yeah, I would say mine's anywhere from 55 to 70. Again, just kind of depending on our coverage, our athletic coverage that day. And just kind of echoing what a lot of people have said, this is really 60 to 70 hours split up between a lot of different activities. So it never seems I won't say it never seems overwhelming, but it never seems monotonous. It's a lot of work, and sports residency is a grind, which I'm sure everyone will agree with, but we've all been enjoying it, and we're all getting a ton out of it. So
That's great, guys. So we have another question here. This is from Judy. What has been the biggest surprise, or what did you not expect prior to applying now that you've been in your residency program? And then part two of that is, what would you do differently if you were applying? So does anyone have a big surprise or something that was different than they maybe expected or they thought when they were applying?
I would say one major thing is that my residency happened to hit was the amount of acute management that we hit. And I think some sports PTs are not as interested in that aspect. So figuring out which residencies stand out as, we're really big into making you guys a little better at acute management. No, we're really passionate about more of the rehab side, and we spend a little less time on-field coverage, was something that I didn't get a great sense before, like during applying, but when I went to the actual interviews and spoke to some directors on the phone, I got a better sense of. So I would say that's one of the components that you should decide if you are invested in that or not so invested in, see if the residency programs match up with that.
I was going to speak a little bit about the Vanderbilt one. I thought I had done a decent amount of research beforehand, but one thing that definitely surprised me was how self-driven, I guess, you have to be. There's not a lot of things set up for you during the Vanderbilt one. There's no, like, all your teaching, there's no lectures or anything like that. You're, in terms of like monographs and preparing you for the SCS exam, you kind of have to take that all upon yourself. They give you the information, but there's no other residents that you get to work back and forth with in terms of the coverage. If you're passionate about one sport, you really have to make the effort with that athletic trainer to get more coverage. People are very open, but you can't sit back and wait for the things to happen, especially with research as well. You have to take that initial step. No one's just gonna say, this is a project we're working on, come join us, which would have been nice, but I didn't realize that, you do have to put in a little more initiative, but all the access is there. I just didn't realize it was a lot more self-driven of a residency.
I think for me, one of the things that I didn't expect as much, and it's probably due to sort of what my rotations were or where they were, but our communication and exposure to the doctors has been really amazing here and really helped me sort of develop or learn how to develop a good relationship with the doctors that refer to us and know what's going on from their side and help them understand some components of rehab. And then they're also teaching us, what they expect to see out of their surgeries and where they, what milestones they like to see. And for that second part of the question, in terms of, anything different when I was applying, I think when I was applying, I kind of like was going through place and I was like, oh, that seems like a research heavy place, and kind of just sort of, I don't really want to do that. And, here I am at a place that would consider themselves research based, and really actually liking it and finding real application in clinical practice for that.
That's great, guys. So it is now 9:15 Central Time, 10:15 East Coast Time. I think the panelists all have a little extra time, so we're going to hang here for at least 5 or 10 more minutes. If the audience wants to hang out, we have more questions coming in, so we're more than happy to keep answering. I will say, if anyone does dodge out now that we've been at an hour, I will be sending you guys an email with information about the recordings. We hope to post both sessions to YouTube. And then I also will email a contact list for the panelists. So you guys can reach out to us individually if you have questions personally, or if you have questions about our individual programs. One thing I did want to touch on, and someone asked about going straight from DPT school into residency versus taking some time and working after PT school and then going to residency. So all the panelists, and myself included, went straight from grad school into residency. So we can't really speak to working after grad school. But Kyle, why don't you speak a little bit to why you chose to go straight into residency after grad school?
Yeah, absolutely. For me, it was just the experience. I was driven to go ahead and get this specialization. Like I said, I knew that I wanted to do youth athletes, and this was kind of it's a niche area that I just wanted to jump into right away. So it was kind of the determining factor for me. Like I kind of talked about with Nick and I living together, this was a constant conversation that we were having about just how do we go about applying to the sports residency. So we had each other to kind of bounce ideas off, and I think that's important too, to find someone in your corner that's going through the same thing as well. But I'm glad that I went straight to residency. I think I've learned a ton. That being said, I don't think it's a bad decision if you do it another way. Just because we're here doesn't mean that you can't get in a different direction. So everyone has their own path, but I'm happy that I went straight to. Absolutely, I would do it again.
Kyle, I think that's some great points. I don't want to talk about the money aspect of things because every situation is different and every program is different. But I think that is a consideration, especially with PT school debt the way it is. And I think you just need to evaluate your situation. If you are concerned about your loan payments and your student debt, and I think you need to consider that when applying to residency, because understand that I would say May's residency, where she gets a full salary, is kind of the exception to the rule. Most of us are getting a discounted salary. And that was a question I did get a lot. And that's individual to every person. We can't answer that. But you really do need to evaluate the financials of it to have it make sense. Because I can tell you that if you go into a residency and you are struggling financially, which I don't think any of us are, it's possible. You can live. None of us are eating like soup and ramen for dinner and lunch every day. But if you are struggling, that is going to negatively impact your experience. So I will just give you all that word of advice. Nick, why don't you jump on your soapbox a little bit? Talk about, someone asked, when did you start applying to residencies? So can you just talk about like gathering that information and when you started doing that? And kind of that process of gathering information and then applying to the residencies.
Yeah. So I'd probably say that I first learned about residencies in my first year of PT school. And I think for myself, it was something that automatically kind of caught my interest and caught my attention and that's almost when I decided that I think it's the route I wanted to pursue. So I definitely don't think there's a time period that's too early to start looking. In terms of applying, I think Trevor, answered it in the chat, but like usually applications are open in October 1st, I believe is the date. And they usually close around December. And then after that, you kind of start hearing back in terms of interviews and follow-ups to that. What I did too was, and I found it really useful and beneficial into determining which program I was going to apply to, was we went to CSM in my second year of PT school. And so I reached out to a couple of residency directors beforehand and just met up with them for 5 minutes just to ask them questions, or met up with current residents to ask them questions. And, getting involved in the academy, I don't think, can be under or overstated here. I think it's important to get involved and just to have conversations and get to know people. because that's ultimately, you know, what's going to make you grow as a clinician and a professional in this setting. And so I think there's no wrong or right way to do it. And going off my soapbox too on that, I don't think there's a perfect answer in terms of what makes us all the ones that are the sports residents right now versus maybe people who didn't get accepted, you know, because I think that we know that is a very, very fine line that separates the yeses and the nos. And so I just say and encourage, you know, future applicants just to go out there, get involved, you know, go outside of the DPT curriculum. You know, it's not all possible for us to get cool clinical settings in sports PT or sports medicine clinics. So maybe you have to go and do something for your, you know, on your own. Or I think CSS is obviously a good thing to have, and it's kind of an easy one. But just going out and reaching out and trying to find opportunities to get into a training room, whether it's middle school, high school, college, professional, and get to know some of the people wherever you are in the sports medicine field. And use those opportunities for yourself to kind of to boost your resume or gain experience in something that you didn't have before. I don't think like I said, there's not one right answer, but you know, those are the things that are going to help you get to where you want to be.
Awesome, Nick. That was a great soapbox. I appreciate it.
Of course.
All right, guys, I don't want to keep all you East Coast people up later than you need to be. So that is going to be it for tonight, unless one of the panelists has a closing thought. Audience members, thank you for joining. This was wildly successful, way more successful than I thought it was going to be. So maybe I don't hold myself to high enough expectations, but this was great. As I mentioned, we'll send you guys a contact list with our information, and feel free to reach out to us, find us on social media, and, you know, ask us questions. I think all of us would agree that we wish we had something like this when we were going through the process. So we want to be a resource for you guys, you know, beyond the 2 hours that we hosted this webinar. And then finally, these recordings should be posted on YouTube. And I hope to be able to email you guys that information so you can go back and view them at your leisure, or give them to other students at your program potentially who didn't have a chance to join us tonight. Thank you, panelists. Great job. And, you know, everyone stay safe, wash your hands, social distance, wear a mask. Have a good night, everyone.
Thanks, Jack.
You guys.
Thanks, everyone.